My genetic disorder is autism. Autism, or more precisely, the autism spectrum disorders, represent a broad group of developmental disorders characterized by impaired social interactions, problems with verbal and nonverbal communication, and repetitive behaviors or severely limited activities and interests. It has become the most commonly diagnosed childhood developmental disorder, and 1 in every 150 children in the United States will be diagnosed with it. Autism can infect any individual and is 4 times more common in boys than girls. It usually develops before the age of 3. The hallmark symptom of autism is impaired social interaction, while many children also engage in repetitive movements such as rocking, spinning, twirling, or jumping, or in self-abusive behavior. The word autism, which has been in use for about 100 years, comes from the Greek word autos, meaning self. The term describes conditions in which a person is removed from social interaction, hence an isolated self. Eugene Buehler, a Swiss psychiatrist, was the first person to use the term. He started using it around 1911 to refer to people with symptoms of schizophrenia. Autism and schizophrenia remained linked in many researchers' minds until the 1960s, where research into treatments of autism focused more on medications. From the 1980s to the current day, the role of behavioral therapy and the use of highly controlled learning environments emerged as the top treatment for autism. Scientists are not certain what causes autism exactly because it is an incurable disease, but it's likely that both genetics and environment play a role. If genetic, which it probably is, it would be sex-linked, as it is 4 more times more common in girls than boys, and it would be found on a mutation on the X chromosome. Of children being diagnosed now with an autism spectrum disorder, about half will have mental retardation defined by a nonverbal IQ testing, and 25% will also develop seizures. When physical features such as small head size or brain malfunction are present, or there is a family history of relatives with autism, genetic testing such as chromosome analysis and single gene testing is done. Many treatments for autism vary depending on the needs of the individual, but in general they include behavioral and communication therapy, medical and dietary therapy, occupational and physical therapy, and complementary therapy including music and art therapy. Autism is an incurable disease. In November's groundbreaking report, researchers described measurable decreases in eye contact between 2 and 6 months age in babies who went on to develop autism spectrum disorder. The babies actually started out with typical eye gaze patterns, but month by month they showed a steady decrease. Babies who did not develop ASD showed the opposite pattern, with eye contact increasing. Researchers using a well-known mouse model of autism found that probiotic known to relieve gut inflammation also improved social behavior in autistic kids. Scientists also found that women with high folic acid levels when pregnant are less likely to have a baby with autism. Thank you.